So if you have many drugs, you may be paying many months of the pure drug expense out of pocket before Medicare will kick back in. The current plan will eliminate that. For people without insurance, there'll be a new insurance marketplace. Essentially a place where you can go and shop for insurance, including the public option that's in the works. You'll get tax credits for purchasing insurance, and as I said, we'll get the public health insurance option that will come about. And for everyone, it supposedly won't add to the deficit, and if the plan does start to add to the deficit, there will be cuts in what happens in the plan to help control costs. There are numerous cost-cutting and fraud prevention measures, and there's a coverage requirement of employers over 50 employees that they have to provide medical insurance to their employees or face a huge penalty.
All right, I'm going to talk about some suggestions that we came up with. The overall cost of government of a healthcare program must be reduced. We must also improve and/or change elements of the plan so as not to make beneficiaries in the country worse off. And the federal government needs to play a larger role in the shaping and overseeing of the healthcare system. The cost of the healthcare over a 10-year period is going to cost the country around $900 billion. And if Congress passed the healthcare bill, the budget deficit will inflate to around $239 billion over the same 10-year period. And here's some ways of securing the money to cover the cost. Squeeze savings out of Medicare and Medicaid, which in turn would give us $465 billion over 10 years. Tax the wealthy, which would give us $544 billion over 10 years. And tax employee health insurance benefits, which would give us $418.5 billion over a 10-year period. And some of the smaller ones, limit itemized deductions of the wealthy, which would give us $267 billion over a 10-year period, and penalize employers who do not offer health insurance, which would give us $163 billion over 10 years.